Hello friends, today we are discussing the 10 questions for the upcoming exams of Drug Inspector. The questions are as follows. Question number 1, nitrofurantoin contains. Options are furon ring, nitro ring, imidazole ring, and option number D is the all of the above. The answer of the above question is all of the above. That is nitrofurantoin contains furon ring, nitro ring, nitro group, imidazole ring. Now the uses of nitrofurantoin are: nitrofurantoin is a first line antibiotic for UTI such as bladder infection, cystitis, and it is used in kidney infection. Now we will see the serious side effects of nitrofurantoin. It may cause lung problems, nerve damage, and liver issues. So what is the mechanism of action of nitrofurantoin? Nitrofurantoin is an antibiotic which is converted into reactive intermediates inside bacterial cells, and these intermediate damage the bacteria's DNA, RNA and protein, preventing them from growing and reproducing. In next slide you can see the nitrofurantoin structure. So next question is question number 2. Which of the following molecule antagonizes the antihypertensive effect of diuretics? So options are: first option is aspirin, second is indomethacin, third is statin, and fourth is quinidine. The answer is the option number B, that is indomethacin is a molecule which antagonizes the antihypertensive effect of diuretics. So we know that diuretics lower blood pressure by increasing the amount of sodium and water in the kidneys and excrete in the urine, which reduces the overall fluid volume in the blood vessels and decreases the blood pressure. Common types of diuretics are thiazide diuretics, loop diuretics, and potassium sparing diuretics. What are the thiazide diuretics? They are the most common type and they inhibit the reabsorption of sodium and chloride in the distal part of the nephron. And loop diuretics, they inhibit the transport of chloride ions in the loop of Henle, disrupting sodium and water reabsorption. And third, potassium sparing diuretics, they block sodium reabsorption and potassium secretion in the distal nephron, helping to retain potassium. So indomethacin can reduce effectiveness of diuretics by causing sodium and water retention and lead to increased blood pressure. And how the interaction occurs? Indomethacin is a non-steroidal anti-inflammatory drug, that is NSAID, and it blocks the production of prostaglandins in the body and impair the kidney function. Next question is question number 3. The number of waves passing a point per second is, options are first power, second wave number, third wavelength, and fourth is the frequency. The answer of the above question is option number D, that is frequency. Question number 4. Which of the following indicator is used in complexometric titration? Options are crystal violet, second murexide, third eosin, and fourth is the methyl orange. The answer of the above question is option number B, that is murexide. Now we know that the types of titration: first is the acid base titration, second redox titration, third precipitation titration, and fourth is the complexometric titration. And the indicators used in acid base titrations are phenolphthalein and methyl orange. In redox titration, indicators used are potassium permanganate and iodine. Then in indicators used in precipitation titrations are Mohr's method, fluorocene, eosine and ferric ion. And in complexometric titration, indicators used are murexide, eriochrome, black and calmagite. These are the metallochromic indicators which are used in complexometric titration. Next question is papaverine is. What is the papaverine? First option is weak analeptic, second vasodilator, third antineoplastic and fourth is the central vasoconstrictor. Answer of the above question is papaverine is a vasodilator. Now, papaverine is a powerful vasodilator that works by directly relaxing the smooth muscles of blood vessels. It is derived from the opium poppy, but it is not an opioid analgesic like morphine. It is a non-narcotic smooth muscle relaxant. So, it is a vasodilator as well as antispasmodic. Now, smooth muscle relaxation. How it works? Papaverine inhibits the enzyme phosphodiesterase. It is an enzyme which is responsible for breaking cyclic adenosine monophosphate, that is CAMP, and cyclic gynosine monophosphate, that is CGMP. And by inhibiting this process, papaverine causes an increase in intracellular levels of cyclic AMP and cyclic GMP, leading to smooth muscle relaxation, that is antispasmodic. And then it is papaverine also causes the calcium channel modulation, that is it decreases the influx of calcium into the muscle cells and inhibit the release of calcium from the intracellular cells which is required for muscle contraction. Next question is question number 6. Drug administered through the following route is most likely to be subjected to first pass metabolism. Options are first sublingual route, second subcutaneous route, third is the oral route and fourth is the rectal route. The option number C, that is oral route, is the answer of the above question. What is the first pass metabolism? We know that it means pre-systemic metabolism and it is the process where the drug's concentration is significantly reduced before it reaches the body's systemic circulation. Next question, question number 7. Which one of the following ingredients improves the flow property of granules? Options are first glidant, second emollient, third diluent and fourth is the surfactant. The option number A, that is glidant, is the answer. So we know that glidants are inert substances added to powders to improve their flowability, reduce interparticle friction, it prevents caking and gives uniform texture. The examples of glidants are talc, colloidal silica, starch, magnesium stearate and glycerol monostearate, GMS. These are all glidants. Next question is question number 8. Gas chromatography technique can be used for. Options are first qualitative analysis only, second quantitative analysis only, third both A and B and fourth none of this. The answer of the above question is option number C, that is both A and B. So what is qualitative analysis? Compounds are identified by comparing their characteristic retention times to known standards. And we know that what is gas chromatography is. It is a separation technique where vaporized compounds of a mixture are carried by a gas through a stationary phase, separating them by their different interactions and volatilities to achieve both analysis. Next question is question number 9. Which of the following device is used to increase the efficiency of drug delivery via aerosols? Options are: first, tube spacers; second, metered valve; third, actuator; and fourth is the pressure valve. The answer of the above question is option number A, that is tube spacers. So in aerosol, tube spacers are devices for metered dose inhalers (MDIs) that hold medication in a chamber before inhalation, allowing the drug to form a fine mist and be delivered more effectively into the lungs. Now the next question, question number 10. Select the equation that gives the rate of drug dissolution from a tablet. Answers are option number 1, Fick's law; option number 2, Henderson-Hasselbalch equation; option number C, Noyes-Whitney equation; and option number D, Michaelis-Menten equation. Answer of the above question is option number C, Noyes-Whitney equation. This equation is used to understand the drug release from solid dosage form. dm upon dt is equal to dA in bracket CS minus C divided by H. Now, what is dm upon dt? It is the dissolution rate. D is the diffusion coefficient. A is the surface area. CS is the solubility. C is the bulk concentration. And H is the diffusion layer thickness. So Noyes-Whitney equation, it describes the dissolution rate of a solid in a liquid, stating that the rate is proportional to the solid surface area, its solubility, and the concentration gradient between the solid surface and the bulk solution. Thank you for watching the video.